Ladies and gentlemen, please welcome Cleveland Clinic's CEO and President, Dr. Toby Cosgrove, and Chairman, President, and CEO of Safeway, Steve Burd.
Good afternoon and welcome to Ideas for Tomorrow. I'm delighted today to have with us Stephen A. Burd, who is CEO, President, and Chairman of Safeway Corporation, which is a Fortune 100 company with 200,000 employees and almost 1,800 stores across the country. Mr. Burd is a business guru, retail legend, and healthcare visionary. He is a native of Minot, North Dakota, where his father was a railroad yard superintendent. He went to Carroll University and then on to the University of Wisconsin, and where he got a degree in economics. He then left there and went to the Southern Pacific Railroad and subsequently into management consultant, where he fixed broken businesses, especially supermarkets. In 1993, he became CEO of Safeway Corporation. At the time, Safeway was struggling with low morale, low sales, and high operating costs. And he did a spectacular job in turning around that particular corporation. Recently, he has become very engaged in changing healthcare and the health of his employees. And I'd like to show you a little video that documents his accomplishments in this field.
Steve Burd is recognized as one of retail's best and brightest. CEO of Safeway since 1992, Mr. Burd has led what has been called a spectacular business turnaround, nearly tripling Safeway's operating profit in the first 5 years. Safeway is one of the largest food and drug retailers in North America and has been ranked by Fortune magazine as one of the most admired companies in the food and drug sector. Steve Burd is considered a thought leader in advancing public policy on issues impacting the retail industry. At the top of the list, healthcare reform.
I've come to believe that healthcare is really this country's #1 domestic issue.
In 2005, Safeway's healthcare bill was approximately $1 billion annually, more than its net income. In 2006, Burd reinvented Safeway's healthcare program, focusing on health, wellness, prevention, and incentives for healthy behavior. In doing so, he slashed costs for both his company and participating employees. Premiums and out-of-pocket costs for workers have decreased 25 to 30%, while their quality of care has improved.
I believe every business can experience healthcare declines while improving the quality of healthcare for their employees.
Bird's plan encourages healthy behaviors, focusing on prevention, wellness, and incentives, while discouraging unhealthy behavior. Safeway pays 100% of standard preventive care, such as physicals, mammograms, colonoscopies, and well child care.
70% of all health care costs are driven by behaviors. They're not driven by genetics, they're driven by behaviors.
So Mr. Burd designed a plan to drive healthy behavior, starting with prevention and wellness, and incorporating management programs for those with chronic conditions. In 2007, Steve Burd created the Coalition to Advance Healthcare Reform, an alliance of nearly 60 companies advocating market-based solutions.
When we say market-based, we're saying that we want consumers to have effectively a consumer report-like document that would tell them what things cost, and when you do that, costs invariably go down and quality goes up.
If I had regular insurance, I would have never called around and asked for prices. I would have just walked in, showed my card, said, I need a physical, and they would say, okay, well, this is what a physical entails, done. So I started thinking, well, what am I getting for this price?
And that shows you how dysfunctional our healthcare system is, that people don't have the vaguest idea how much they're spending on healthcare, close to the closest $10,000 or $20,000 often when they go to the hospital.
Burd is pushing for market-based healthcare reforms where everyone has coverage and the marketplace helps drive innovation. Burd also believes there needs to be a safety net so low-income families are in the system and can afford coverage.
By law, every American is covered now because they can walk into an emergency room and they cannot by law be denied. And that is a very humane thing, and it is also a very stupid and expensive way to take care of these people who have needs and can't afford it.
Spotlighted in the New York Times, Steve Burd is building momentum across the political spectrum to promote healthcare reform to the federal government.
We are determined to solve this problem, and there's no other alternative. We have to solve it.
Solving challenges is what Steve Burd does best. Today, Mr. Burd is positioning the Safeway stores to compete with new rivals, emphasizing value pricing and a new lifestyle format. Under Mr. Bird's direction, Safeway has become a national leader in supporting charitable causes. Over the past decade, the company has raised and donated more than $1 billion. Called Clever and Candid by Business Week, Steve Burd is a leading figure in business at the forefront of a national movement to reinvent healthcare in America.
Steve Burd is considered one of the most talented CEOs by many on Wall Street. Ladies and gentlemen, please help me welcome a gentleman who is trying to make healthcare better for all of us across this country, Stephen Burd.
Thank you. Well, for starters, it was worth coming to Cleveland just to get an introduction like that. I've seen pieces of those film clips. I've never seen that film, so I have no idea when I'm getting introduced how I might be introduced. But what I thought I would do, I think we've allocated. I got to get this thing to go in the right direction. Let's see. There we go. What I thought I'd do is kind of give you a quick look at the agenda. I'll try to get through this agenda in I think about 30 minutes, and then we'll have time for some questions. So to this particular group, at least those of you that are in the medical profession, the healthcare challenge is not new to you, and probably not new to anybody here if you've been following the press. But I want to talk briefly about the healthcare challenge because I think it's something that the entire business community needs to get their arms around. And then talk a little bit about how we designed a healthcare plan at Safeway that actually lowered our per capita costs while simultaneously improving the quality of care. And then I've been engaged, as you saw from the film clip, in trying to affect government policy. And my basic strategy is to find about 30 or more companies that can mimic the Safeway experience and then go to the Capitol, where I spend a little bit of time, and be a working model of how the rest of the economy can work. That's the basic strategy here. And then lastly, I talked to you a little bit about the fact that we think there's an opportunity for our company. We're forming a healthcare services company so we can help other companies that struggle to lower costs, lower their healthcare costs as well. Shouldn't be a surprise to most of you that healthcare costs, going back to 1970, which is essentially when I began my business career, have been escalating at a pace 4 times that of the Consumer Price Index. In fact, if you were to look at the Consumer Price Index over the last, say, 5 or 10 years, a full 50% of the rise in the Consumer Price Index is explained by the rise in healthcare costs. So if you want to get the consumer inflation under control, you have to get healthcare costs under control. The reason businesses should be very interested in this is it's eating up an increasing amount of gross domestic product. So again, if you go back to the early 70s, GDP for healthcare was about 7.2%. That number is over 16% today. And if that inflation rate were to continue, you'd have about 26% of GDP represented by healthcare in the year 2020. And what I tell businesses routinely, that's going to cause American business to cease to become competitive in a global marketplace. Oftentimes, you'll hear people advocate national health care, and then they think they can tuck that away. My belief is that health care costs are either in your salaries, and people pay for their own health care. It's in their benefits, and that is provided partly by the company. And frankly, if you nationalize health care, it'll be in your taxes. So there's virtually no way to remove healthcare costs from the products and services that American businesses provide. So fundamentally, you have to do something about healthcare costs, or we will cease to be competitive regardless of who pays for that healthcare. If you look at it on a per capita basis and among other industrialized nations, you know, we're the highest in the world. We're more than twice some other industrialized nations. And if Americans were living longer or we had lower mortality rates, maybe someone could argue that that's a good thing. But if you look at mortality rates per thousand, you know, I'm not going to argue that that's statistically significant, but clearly our mortality rates in this chart are actually higher, so we're not benefiting from lower mortality. And if you look at life expectancy, we're not really living any longer. Now, the truth is, in this country, the wealthy do live longer and probably have lower mortality rates, but because we have about 47 million people that are uninsured, they bring those numbers down. And you're going to hear me advocate that everybody sort of be in the system, and if they're not in the system, a market can't really work. If some people get health care that might be free, then it just doesn't work for everybody else because we end up subsidizing that health care. See if I can get my next slide. The root causes, I mean, the healthcare crisis that people refer to is both a crisis of coverage and a crisis of cost. And my belief is that you can't solve the coverage problem unless you, in fact, solve the cost problem. And so what I thought I would do is outline for you what I think are the root causes of the cost problem. The first is that too many consumers, in this case 47 million, are not part of the system. And so that doesn't mean they don't get some form of health care. It probably means they get no preventative care. But essentially the laws of this country, and I don't think anyone would advocate that we change them, require that if you need care, you get care if you show up at a hospital. And so we want them to be part of the system, and we think that those of us that are insured pay a premium because we're basically subsidizing this group. And about 25% of this group has the financial wherewithal to, in fact, pay for their own insurance. You also have some workers that are heavily insured. I mean, so heavily insured, they have no financial responsibility themselves. I've often used the word no skin in the game, and therefore they overuse health care. I can think of a number of companies, particularly in the technology field, where there are no co-pays, there are no premiums, and there are no deductibles. And then there could be some union contracts where also people would overuse the system. And then a big problem is the lack of cost and quality transparency. You know, you take any consumer good. I like to think about the cell phone. I got my first cell phone in 1986. It was the size of a brick and weighed about 7 pounds. It was a Motorola. Some of us had it. And when you bring competition into play, the cost of products declines and the quality routinely goes up. Flat screen TVs used to cost $20,000. Now you can buy one for $500. I mean, imagine what that BlackBerry does today that computers couldn't do in the late 70s. So cost and quality transparency is essentially absent. And if you had that, you have it for all of the products, you would bring the cost of healthcare down. And then insurance policies generally lack incentives for people to engage in the right kind of behavior. They don't reward for good behavior typically, and they don't penalize for bad behavior. And yet I've come to believe that a full 70% of healthcare costs is driven not by your DNA, but in fact is driven by behaviors. And that to me was a real piece of good news because it said that we at Safeway, and I think we in the nation, can actually have an effect on healthcare costs. And then providers of healthcare have little incentive to be cost conscious. Most of what you think of our healthcare companies, healthcare insurance companies, are really just processors of claims. And so the company I think that has the most real insurance business has about 50% processing and 50% at-risk real insurance. And so they don't really have an incentive, and they deal with HR departments in big companies. They don't want to upset the HR people, so they don't talk about non-smoking campuses and charging more for smokers and having insurance premiums that would be higher for people that might be obese. So no one really does that. And so as a self-insured employer, we've started to do that on our own. Because you have a group of the population, we think 15%, that are uninsured, and you have another 20% that would be underinsured, then the fully insured, which it's probably a good bet that that's everybody in this room, we actually pay, we think, about 30% more for our insurance because of what's going on in the rest of the insured and uninsured world. I think it's a very solvable problem. As a sort of a trained economist, I mean, now a business guy, it's great news that 70% of healthcare costs are driven by behaviors, because it says if you redesign your healthcare plan where behavior matters, you can actually have an effect on cost, and you can have an effect on the health and productivity of your workers. You know, so that to me is a large dose of good news. If it were 20%, that wouldn't be as good. And then the second fact that caused me to be optimistic about this subject is about 74% of healthcare costs are confined to 4 chronic conditions. In business, we always talk about the 80-20 rule. Whenever we want to do something that we think is big and impactful, we usually discover that about 20% of the effort gives us about 80% of the benefit. So imagine if 74% of the healthcare costs were confined to 500 chronic conditions, how hard that would be to deal with. But the fact that it's confined to 4, and those chronic conditions are heavily impacted by behaviors, say that you've really got the makings of a solution here to rising healthcare costs. I believe that every private sector company can experience what Safeway has experienced. And I'll go further. Any organization can experience what we have experienced. And the only thing we've done in our company to date is plan design changes. The next 2 steps are to make some fundamental changes in the transparency on cost and quality, and to affect our pharmaceutical spend, which I'll talk a little bit more about later. We think that by setting an example, Safeway can become more than a novelty. We can actually become a template for how the nation addresses this problem. Many of you, particularly those of you at the Cleveland Clinic, you know, are well familiar with the 4 chronic conditions to the left. I might start with my overlay. Cardiovascular disease, and again, I take a risk here because I'm sure their room is full of some cardiologists, but I bought into the notion that 80% of heart disease is in fact preventable, and yet it's the number one cost item and the number 1 killer in this country. In terms of cancer, we do a lot of work with the cancer community. Last year, our company raised $28 million for cancer research. This year, it'll be probably in the low 30s or mid 30s, so we're very close to the cancer community. About 40% of cancers are in fact preventable, and the other 60%, if caught early, are often quite manageable. That was not true when I was younger. And then you've got diabetes, and I think it's about 10% of diabetics might be type 1 or juvenile diabetics, and the balance would be type 2 diabetics. And about 80% of those would be completely preventable and often reversible if you are in fact a type 2 diabetic. And then finally, a whole host of conditions that result from being overweight or obese, not including the 3 conditions I just mentioned, all of which are impacted by being obese. And again, I'm using the term here. It's, you know, I think when I was a young kid, this might have been a descriptive term. It's now generally accepted. I'll use this term loosely as a medical term. It's a definition of where people are considered to be obese or overweight. Now, if you have some of these chronic conditions, generally patients are not that compliant. And so with coronary artery disease, maybe this means they're not complying to, they're not taking their statins. It may mean they didn't change their diet. It may mean they're not engaged in exercise. And so regardless of the chronic condition, there's a lot of noncompliance. Well, why is that important? In Safeway's healthcare plan, we reward for compliance. Now, we don't have TV cameras, you know, in your bathroom to see if you're taking your statins, but we do know if those scripts are being filled on schedule. And it's something like 62 or 65% of all scripts are not taken on a regularized scheduled basis. People miss. And if you're not taking your hypertension medication, the 3 days you choose not to take it could be one of those days that you have a stroke. So in our healthcare plan, compliance matters. In fact, the way I would describe this to you, behavior in our healthcare plan essentially has become a form of currency. And that currency is your way to buy down your healthcare premium. So if you have great behavior in Safeway, you have a lower healthcare cost. And of course, you have a healthier condition as well. I think all of these numbers are low, but I thought I would start with some numbers that would be without controversy. A smoker, and I've seen numbers as high as $3,000. A smoker will cost at least $920 annually to insure. And those would be the hard costs, not the soft cost of maybe absenteeism from work should you be a heavy smoker. So to us, it makes sense. You know, just like with automobile insurance, behavior matters. If you have a lot of speeding tickets, you pay more for insurance. If you have a number of accidents, you pay more for insurance. Well, these are controllable behaviors, and so in our company, you pay a higher insurance premium if you're a smoker. Starting this year, if you are judged to be obese, although I'll tell you one of the things we do on obesity that I think you'll find interesting, if you have a body mass index of, let's say, 40, and we will charge you a premium above that of everybody else in the organization. If you then make 10% progress within that calendar year, we will rebate to you the entire premium for having been obese at the start. Now, if you get down to a 36 BMI, you'll be in the same group next year, but again, if you get down to another 10% reduction, we'll reimburse that premium. So it's all about making the employee have good behaviors so that they become healthier. Uncontrolled hypertension, all of these things cost money, and therefore we think the insurance plan should accommodate that. If transparency is new to you, these numbers will shock you. I think some people think that market-based solutions to healthcare don't work because they think of, the emergency. Everything is an emergency. Well, the item on the left here, a colonoscopy, you have roughly 50 years to decide where you're going to have this done. I mean, how hard is that? And yet, within 30 minutes of our office, we found a 10-fold difference in the cost of a colonoscopy. Hernia repair, 3-fold difference. Orthoscopic knee surgery, 4. Normal child care delivery, 2. Within 10 minutes of the office, and again, just doing a quick survey, and there's sort of the listed number and then the unlisted number, but the listed number you'd get when asking what the cost of a blood test would be, a standard blood test, there was a 5-fold difference. And so that's the kind of transparency that consumers need. And then if they have enough individual responsibility, they'll respond to that. So in our plan now with the colonoscopy, we're basically creating transparency on a company website that tells you within the following zip codes, here are the alternative places you can go. And while we pay 100% of the cost of a colonoscopy, we cap that at a reasonable cost. And that reasonable cost in a market could be $1,000 to at most $1,200. And that would say that the balance of that, $5,600, would be entirely on you. If you want to go to that place, that entire $5,600, and it doesn't count toward your deductible. And so that changes behaviors. To give you a few statistics on Safeway, we have a $1 billion healthcare bill. And that's what got our attention. It was rising at the rate of 10% a year. So every year it was going to go up $100 million. We thought that if we really got into this thing, that we could figure out ways to contain that cost and actually cause it not to go up. To our surprise, we actually found ways for the per capita cost to go down. Now, I've talked to other companies that have lowered their costs. They lowered their costs by letting go of 2,000 employees. This is actually a per capita cost. And then you saw in the film segment that we shared most of that savings with the employee because we had 2 healthcare plans at the time. We wanted to encourage people to get into the new plan. So their out-of-pocket costs dropped about 25 to 30%. We added benefits in 2007, well baby care, well child care, pay for mammograms, annual physicals at age-appropriate levels. And so we flatlined it in 2007. The estimate is 2008 will be flat. I actually believe it'll go down because we're starting to get at the pharmaceutical spend as well in our company. And normal case, it would have gone up about 23%. So we've opened up maybe about a 40% gap with the rest of industry. What are the features of a plan that we think works? First of all, it starts with a fair amount of individual responsibility. Typically, in a well-designed healthcare plan, the employee is going to have anywhere between 25 and maybe 30% of personal responsibility for those healthcare costs. If you don't have that, then none of the stuff that I described is really going to work. we think that it makes sense to focus on the prevention of wellness. And so we have taken certain things that I've already enumerated where we would pay for 100%. We have, in the first year, we had the employee fill out a health risk questionnaire. We gave them a small incentive to do that. In the second year, we had the spouse fill it out. Next year, we will have the balance of the family fill it out. And we're contemplating actually making it a requirement to get insurance. So it's no longer an incentive. So we're evolving over time where if you want health insurance, you actually have to fill this thing out. That gives us a baseline to see whether there are any special needs out there that we can meet with our care management services. We also have what most companies I think have today, a 24-hour hotline that you can access a nurse and get help really 24 hours and 7 days a week. And then we have a number of wellness programs in the company. We have a large campus where we installed a fitness center. We've broken the organization into health and wellness teams. I report in the quarterly earnings over a conference call, go into an auditorium like this, and also report in the progress of health and wellness teams. And we're a competitive organization, so everybody wants their team to do the best. And so we follow the basic metrics that you would expect us to follow. I think that if I told you everything that we did, you would conclude that we're being pretty intrusive in the lives of our employees. And the reason I believe they accept that is that we've taken a very holistic approach to health and wellness at Safeway. We're a large retail organization, as Toby indicated. And so while we have a fitness center on campus, we have about 2,000 physical facilities around North America. So how we accommodated them with fitness is we wrote a check to two large fitness organizations, Bally Fitness and 24 Hour Fitness. And we bought down the initiation fee, which is often $150 to join one of these fitness centers. And then we got a deep discount for any of our employees joining. And so it's not just being a corporate employee. You can be a clerk in a store. You can be a bagger or a checker, and you have this opportunity at Safeway. We will be organizing wellness teams throughout our system so that stores will also they'll represent a team. We didn't initially have calorie information in our cafeteria. I mean, how can you not have calorie information? And also, other key elements of what those meals. And when I look at the menu today, I look first at the calories, and then I look at the ingredients, and then I look at the description. And that's how I decide what I'm going to have for lunch. And we're soon to launch, here it says Care Connect. I've been referring to this as concierge service. Because we've been a bit intrusive, and we'll get even more intrusive, we're creating two sort of concierge services at our company, one for cancer, one for cardiovascular disease, to remove the mystery once you've been diagnosed with, say, cancer, to make sure our 200,000 employees and their dependents get the proper care. I think oftentimes with common diseases like prostate cancer and breast cancer, the popular press likes to suggest that there's this big mystery about how you decide. And believe it or not, it's not uncommon for a urologist to give you a pamphlet and say, read this pamphlet if you have prostate cancer and tell me how you'd like to be treated. And I don't think that's an appropriate sort of thing to confront the patient with, because I think the science here is pretty clear. We've evolved, as I've said. I might skip through this because we've sort of layered it in over time. We're now going to take on sort of a subchapter in healthcare. This started with another CEO in the food manufacturing business, Indra Nooyi of Pepsi. We spoke at a conference, I think it was in February, and we decided to take on a nationwide challenge. We've all read about the obesity epidemic in this country, particularly with children, and how that's creating an epidemic in diabetes. And so we decided that we would see if we couldn't contribute toward reversing that trend. Now, it's kind of a bold mission, but there are about 12 CEOs that have met twice now. We've laid out a plan on how we would do that. And then I've said to all of those that we have to demonstrate in our own companies. We have to get a baseline measure. We have to demonstrate we can drive conditions of overweight and obesity down in our company. And once we've done that, I'll contribute to a multi-million-dollar marketing campaign to try to teach the nation how to do that. Because the bottom line is, unless you control obesity and conditions of overweight, you will not control healthcare costs, because they are such a big driver in the equation. So I will launch this we have a broadcast network in our company. I'll launch this with some kind of a video. The objective is to try to get our employees to lead a healthier life. I've got a little shock and awe piece. I haven't written it yet, but it's to link conditions of overweight and obesity with a lot of health conditions, from cardiovascular disease to diabetes to cancer to Alzheimer's and a number of other diseases, to try to just get people to realize that they're making decisions today that could affect them for the rest of their lives, and albeit a short life. So we have made some, I think, discoveries. I might call them insights. I think the big insight in healthcare is the behavior and the linkage to 4 chronic conditions being 74% of costs. So many people struggle with weight. We included in our group the founder of 24-Hour Fitness, and I learned a ton from him about how we can help people affect weight loss. And so let me just go. It's about calories in and calories out. You want to have a balance. Let me flip through this and try to share this insight with you. Most people that have tried to lose weight, they try to fit their lifestyle to a program, and that really doesn't work. You need to fit a program to your own lifestyle. And diets don't work. This is a layman's view, but I think a lot of medical professionals would agree with me. Diets don't work. So how do you integrate into your own sort of lifestyle pattern things that you can easily do? We think that the right answer is to lose about a pound a week. That's how we're designing our plan at Safeway. We think that it's a nice mix of maybe half of that would come from calories in, and the other half might come from calories out. So if you're used to having a latte from Starbucks, hopefully they're not here. Well, have their coffee, okay? If you're used to having a latte, that's an easy 300 calories every time you have that latte. If you have 5 lattes a week, there's almost a half a pound. If you have salads every night like I do, and you like Caesar dressing or ranch or blue cheese, go with a low-cal vinaigrette, and you'll save 250 calories a day, half a pound over the course of a week. A number of other things on here. My sin was grabbing a handful of M&Ms when I came home from work, dinner wasn't ready, and then grabbing another handful. I cut that out. That was 250 calories. If you're a golfer, don't ride the cart, carry the bag. It weighs about 30 pounds. You'll burn 1,750 calories in one 4.5 round, unless you hit it right down the fairway, okay? If you're a 2 handicap, you probably only lose about 1,500 calories. Now, on one of the things that I struggled with as I developed this plan for our company was, I'm an empty nester, so it's easy for me to add a couple cardio workouts and easy to go to the gym. And frankly, I think if you don't have kids, it's probably pretty easy to make the time. But what about young families, soccer, baseball? You're eating at McDonald's or Burger King. I mean, how do you get exercise, and how do you get nutritious input? Well, in my world, I easily spend 6 hours a day or 6 hours a week on the phone. I mean, it's probably more like 6 hours a day. Standing burns more calories than sitting, so stand. Pacing burns more calories than standing. If you were to talk on the phone 6 hours a day with a headset and pace, 6 hours a week, you'll burn 1,750 calories. And so you don't really have to go to a gym. And so all of these, I won't read through all of these, but 2 hours of playing billiards 5 days a week. Why? Because you're standing. So you just integrate it into your lifestyle, and you can lose at the rate of a pound a week. And then you're going to have to change your lifestyle again, otherwise you'll keep losing weight. So now, of course, your metabolism sort of adjusts for some of that. But anyway, I think that we've got a program. So we'll have a website for our employees. Here are all the standard activities that you engage in. Here are all the standard ways you can cut out calories. And they'll have an easy tool to decide how they reach their targets. And then the last thing I would tell you is we think small groups work. And we think peer groups work great. And so you share your target, you share your time frame, and you report out to each other every week. And no one likes to miss targets. And it's really borrowing a page from Weight Watchers, if you will. We do a number of things for our customers. Obviously, we intend to do a lot more. That's probably the signal that says I'm done. Is that what that is? Okay. That's somebody's cell phone then. One of the things that we let our customers know is, the great virtues of some of the produce that we have in our stores. We've got a website we call FoodFlex. I'm going to show you a couple of pages from FoodFlex. And then, we're trying to do everything we can to improve the health of not only our employees, but our customers. And so we raise money for breast and prostate cancer every year. We support Easter Seals and MDA. And we provide over $100 million annually to local food banks. So we're really engaged in the community. And we've got a new product line called Eating Right, which is better for you products in virtually all different categories. A little hard to read this, but if you're a loyal Safeway shopper, we have a loyalty card, and you can go on this website called FoodFlex. You can download your last 6 months worth of purchases, and you can compare the nutrition of your particular household purchases to that of a normalized diet, or even a heart-healthy diet, or an extreme heart-healthy diet. So I chose this one, which is not me, but somebody is consuming 253% of what would be a normal sodium in their diet. So then you can click on sodium, and if you look over here to the left, it will list every product you bought in the last 6 months from highest sodium content to lowest sodium content. You can then click on the highest sodium content one, which here is a progressive soup, and the next page you'll get will be all other soups you could get from lowest sodium content, and you see many of them have none, to highest sodium content. So it gives the consumer an opportunity to manage their sodium or any other vitamin or mineral content. We have about 30,000 users today. We haven't marketed this really hard because I want to introduce a little more flexibility into the FoodFlex system. And then they can see how they trend over time and see if they're doing the right thing. We think that we will be the first company in North America to offer our employees a discount on their health insurance if they want to opt in and demonstrate that they have a healthy, nutritious diet. And I think other insurance companies who are self-insured will then, I think, follow suit. In terms of government policy, as much as we've done all of this without any help from the U.S. government. Today, if you want to differentiate between the best behavior and the worst behavior, you're only allowed to do that with 20% of the full family cost, which if the average cost for a family coverage in this country would be around $12,000. So that means you've got about $2,400 in family coverage you can differentiate. Well, imagine if you have two smokers, both with hypertension and cardiovascular disease, and one of them is a diabetic. You don't have enough money to play with in order to drive the right kind of behavior. So one of the reasons that we've gotten involved in policy is we want to create more headroom, if you will, so that we can differentiate, with larger set of numbers to get the right kind of behavior change. The coalition that was mentioned in the film that formed, we've got about 60 like-minded companies that believe that the healthcare system in this country doesn't work. It doesn't work because it's not free to work like a market. We'd like a market-based solution. We all agree that we'd like everybody in this country covered. We realize that we have to provide financial assistance for low income. Anybody who's run the numbers on that would tell you that if you could lower the nation's healthcare bill 10%, you could actually finance the subsidy to the low income. And I believe you could actually lower the nation's healthcare bill by about 40%. We've lowered ours by 13% by only focusing on plan design. When we get into transparency and some of the other things, we'll continue to lower those costs. And then, we insist on a healthcare plan that has healthy behavior incentives. And then I think others have been talking about how important it is for individuals who might buy insurance to have the same tax benefit treatment that companies have. That's not true today. And that keeps some of the entrepreneurial small companies uninsured because they have to pay for it with after-tax dollars. This is just a list of many of the companies that are in the coalition. This thing is limited only by my personal time. Obviously, I have a company to run, so I can't spend all my time trying to recruit other companies, but it's opportunities to speak in groups like this that usually stir somebody to be interested in joining the coalition, and that's one of the reasons why I was eager to do this. And then, we're focused on the presidential candidates. Fortunately now, they're no longer 18, we're down to 3, so we can just focus on the 3. Pretty soon we'll be down to 2, and we advocate the principles of the coalition. We often bring business people to the table so these presidential and other policymakers can actually dialogue with people that are in business and wrestle with pieces of this problem. And then we proactively engage the media to advance these principles. The last thing I would tell you, I mentioned this a little bit earlier, we elected, I've formed 2 other companies, so we're not just a food company, but we think that there's such an opportunity here that we should form a healthcare company. So we will have that company formed by the end of this quarter. We partner with 2 companies that have expertise that we don't have, and collectively we will lower the costs of other companies that have found it difficult to lower their healthcare costs and improve the health of their employees. I'll just flip through these because this last slide just shows you where we think the money is. You know, Willie Sutton said he went to banks because that's where the money was. I could call this is where the money is. It's also where this is where healthcare is. We think that about 20% of the nation's healthcare bill could be reduced with transparency. I've color-coded how much of that would accrue to the public and then how much of that would accrue to the private sector. So the private sector would save about 11%. And I remember I was in a meeting with one of the presidential candidates, and the question was asked, how long would it take to create this transparency? And one of the technology guys in the room said 10 years. I said 6 months. And it's because I believe in the 80-20 rule. Medicare is about 40% of the spend today. So there's a lot of data right there. You could pass a simple piece of legislation that would make that cost, you know, the quality information wouldn't be as good, but you could provide almost instant cost information. And businesses could basically merge their data and provide, you know, because you just want the key things. Would I have it on every procedure? No. Would I have it on colonoscopies and mammograms and all this stuff and blood tests? Absolutely. So you just do what you can and you do it quickly because it's worth a lot. Behavior is worth about 15%. Emergency room, switching it to regular. Remember, if everybody gets insured, now they get preventative care as well. And the chances of discovering breast cancer at stage 4 are less. You might actually discover it at stage 1. And then the uninsured will contribute something because many of them can afford to actually pay. And so my objective here would be, instead of tracking to, you know, a 25, 26% GDP, that through a combination of initially reducing the cost of healthcare and then causing it to flatline and then ultimately experiencing someday normal inflation, you could conceivably by 2020, if you really got after this, bring healthcare back down to about a 7 to 8% GDP. Now, you'd have to move very fast. But I think it's conceivable.
Come over and have a seat. Steve, that was fabulous, and I know that many people here have some questions, and I'd be delighted to answer them. It looks like we've got to run right up here, ready to go.
Okay.
Hi, Mr. Burd. We're very glad you're here. I wanted to know, given your forward thinking, your vision, and commitment to healthcare reform, how do you think you can personally influence government change overall?
How do I think everybody can, or how do I think I can?
Both.
Okay. I think everybody can by engaging in the debate. You know, depending on your position, you either have access to policymakers or you don't. And you should let them know how you feel. In my particular case, the CEO of a Fortune 100 company can get in to see any senator, any congressman in this country. And I've learned over time that we have easily 10 times, maybe some would say more, impact than a lobbyist. And so they really like hearing from practitioners in the field. And then what I tried to do to sort of up my impact, besides get smart about the subject, was to form a coalition of businesses so that when I come in to speak to a senator, I've really got 60 other companies behind me that feel the same way on those issues. And then when I'm questioned, I'm careful to wear 2 hats. One is the CEO of Safeway, and the other one is chairman of this coalition. And if I think that I'm about to make a comment that might not be fully supported by the coalition, I would then say that. I would say the vast majority of the coalition would be supportive of this, but not all, but here's what I think. And so I think that this is a big problem for this country. I think that Washington is really ready to respond to companies that actually have done something that they're looking to try to do for the nation. So I had President Clinton tell me at a function that I attended that he said that he thought that I was the most credible person on this side. It's not going to be televised, is it?
All over the world.
Okay. Well, she might enjoy the most credible person on this subject in the country. And I looked at him and I said, more credible than anyone? You know, implying that, you know, he was living with someone who had to be as credible, you know. And he said, yes. And what he was really saying, what he was really saying is that you've actually lowered costs, you've actually improved the quality of care, and keep telling the world about that. And so we decided to take it a step further. It is a business opportunity for us, but I don't know how many businesses that are represented here, but I could tell you, I could take any business, any organization in this room, and I believe lower your pharmaceutical spend by 25 to 30% without sacrificing any care, and it would take about 12 weeks. On the medical side, with the plan design change, you probably have to wait for a lot of those savings for next year, but could lower your costs at least 15%. And then there's so I really my plan is to have 30 companies 18 months from today that have a per capita cost decline, and I think we can have a huge impact on policy. And then because I'm equally interested in reversing the obesity trends, which is a pretty, I mean, obviously I like doing things that people think are really hard. They're generally more valuable, and they're a lot of fun if you can pull it off. And I'm not saying that, you know, I'm faster than a speeding bullet and more powerful than a locomotive, but with partners, I think you can accomplish almost anything. And I'm not going to leave Cleveland without getting the Cleveland Clinic as my partner.
How many of you here think that if he'll have us, we ought to become a partner with him? Anybody? Yeah, up here.
I'd just like to say excellent presentation. It was very informative. With tobacco treatment being a very personal thing and something I do here at the clinic, what advice or lessons learned would you give to a company that wants to try to lower its healthcare costs?
Well, I guess the first thing I would tell you, I'll confess here that internally in the organization, I mean, not that many CEOs get as, outside of healthcare, get as engaged in the subject as I do. Why did I? Because we're a very low margin business, and therefore healthcare costs loom large in the scheme of things. And so I had to battle my HR team. I now have a new head of HR, Toby. So,
me too.
So that battle's over with. And then I had to battle not my general counsel, but some of the other lawyers that have expertise in employment law. And what I routinely tell my organization is that if I'm convinced that something is illegal, okay, I'm not going to violate the law, but I'm now going to ask my government affairs team to go change the law. In fact, I said to Hillary Clinton on a very narrow subject, I said that if I'm convinced that the law is getting in the way, I said, I'm going to come see you, and I'm going to ask you to change the law. And her response was, that's exactly the right thing to do. I mean, people are really primed to do something here. And so I think laws that might have been harder to change in the past, I think are easier to change today. So I would say stick with it. The keys are there has to be some financial responsibility. Don't let somebody tell you you're being too intrusive. I think that if somebody tells you that, then chances are you're not being intrusive enough. But if you take a holistic approach, I mean, I've got 200,000 employees, and let's see, 170,000 of them are unionized. The union leaders that I have historically struggled with, because I've had 9 strikes, we make joint Hill visits together in Washington. I have a great relationship with all of the key union leaders. And why is that? Because they see healthcare costs eating up their ability to get wage increases. And so they want to tie themselves to somebody who thinks they can actually lower per capita healthcare costs, because that's good for everybody, improves the health of everybody, and gives them an opportunity to get wage increases. So now we're on exactly the same page. You're welcome.
Looks like there's one more up here.
Okay.
Hi.
Hi.
Have insurance companies responded to your success, and have they reduced costs to companies that reduce healthcare usage?
They responded in a couple of ways. As I said earlier, we're self-insured. And I once counted, I won't name them, but there were 5 CEOs from the insurance company industry that called me to ask me how we had done what we had done. So there's certainly a curiosity. But again, if they came to Safeway 5 years ago and offered up an idea to our HR department on, let's say, why don't you make this a non-smoking campus and don't hire anybody else that smokes, you'll lower your costs. HR would have probably thrown them out, and they might have risked getting, the processing work the following year. And so I don't think they've been encouraged to be creative. They have an enormous amount of data. And I will tell you, that's another problem here, because they have the data, we don't. And so we've had to get that data, obviously on a HIPAA-protected basis, to do the analysis, to figure out the kind of premiums we would charge for certain kind of behaviors and the kind of discounts we would provide for others. It's not readily accessible. And I would say historically, they haven't really thought that way. Some insurance companies are a lot more progressive than others. And I think when we create a healthcare services company, the market will work, and you'll see a much better response out of a standard healthcare insurance company.
You had a little discussion for a couple hours with Mike Roizen here. What did you tell Mike that you thought that we should do, or vice versa, that you might have learned from Mike?
Oh,
if anything.
Yeah, well, I think that, a couple things. I think I'll start with, some advice I offered up. I mean, I think that we talked a little bit about the obesity challenge. And I know it's a difficult thing, but if and I'm confident, everybody here would like to see those trends reversed.
Right.
If you want to see them reversed, then you need to join a group of business folks that are determined to reverse it. And in order to be credible, you need to reduce obesity and conditions of overweight in the Cleveland Clinic or in your business. Because we've got $100 million worth of marketing that my consumer packaged goods companies are willing to throw at this, but I said, let's prove we have a solution first. You can't prove you have a solution until you do a baseline measure. So my advice to Mike was, you got to measure the baseline, and then you've got to measure that, say, 12 or 18 months out. I actually believe, Mike, that in 3 months we can demonstrate progress, because I've done enough pilot work at Safeway to demonstrate progress inside of 3 weeks. So I think on a broad scale, you could demonstrate progress inside of about 3 months. And then I think you absolutely have to have a healthcare plan that rewards good behavior / penalizes bad behavior.
Right.
And then a couple of things I learned from Mike, the little go thing that you have. I mean, that's a step above, calories and some other information. So he's already emailed that to me. I don't know if that's a violation of any policy, but if so, he didn't.
He violates them all the time.
Yeah. All right.
Just ask the governor.
Yeah. But I really think that what I'm finding in this area, I never have a conversation with anybody about healthcare where I don't learn something. And then we try to apply it. And I think that you're trying to do so many things at the Cleveland Clinic that we want to do. And so as a network, we ought to just work together on those things because we'll accomplish more together than we possibly can on our own.
Absolutely. One more question back here, Debbie.
Thank you for your insights, Mr. Burd. My question has to do, could you say a little bit more about how you manage the perception of intrusion in the lives of your employees?
Yeah. I think the best way to do that is...
Excuse me, that was pointed straight at me, in case you're wondering.
The best way to do that is through comprehensive communication. I mean, I don't walk into a meeting that healthcare doesn't come up, okay? I don't do an earnings call and then an auditorium meeting after that when we talk about the health and wellness progress that this issue doesn't come up. We'll hold lunch and seminars. 3 or 4 weeks ago, we had Dean Ornish come in and talk about nutrition. We've had Peter Carroll come over and talk about prostate cancer. We've had others from UCS come over and talk about cardiovascular disease. So we have a large educational effort that's constantly ongoing. We are about to break. We have not really broken. I was supposed to do a video before I left, but I wasn't able to do it, where we will announce our, I call it the concierge service for cancer and cardiovascular disease. That will buy us an enormous amount of tolerance because, we're providing something that's not available in the market today. I mean, I risk this with this crowd here, but it's my understanding that if you're, it doesn't happen at the Cleveland Clinic, but it happens all over this country, there's about a 30% chance if you take chemotherapy that you get the right chemo, and maybe a 40% chance you get the right chemo and the right dose. I mean, you get the wrong chemo. And so, what we're trying to do with the concierge service is make sure people get the right treatment. The right treatment always yields the best outcome, and good news, it yields the lowest cost. And so we talk a lot about health and disease. We hold seminars, and we talk about the next chapter in the healthcare movement at Safeway. And then we also talk about the things that we're doing with consumers. So I think it's more communication than anything else. They know that we're interested in their ultimate health, and it's not about, we took our cost savings and gave it to the employees. So we had a 13% reduction, but we lowered their cost 25 to 30. So they know what we're trying to do, and I think that buys a lot of tolerance. The health risk questionnaire was considered to be intrusive. When we explained why, then they understood it.
Okay. Just one last question over here.
An excellent presentation. About a year ago, a very sobering statistic was given to me that within our community right here, within the next mile to 2 miles, a person could not buy a fresh banana, a fresh orange, or a fresh apple. I'm curious to see how we can partner with businesses to come into communities that we serve also in terms of the issue of health and wellness, and allowing grocers to allow fresher foods and more palatable foods so that the patients just don't taste fat and salt and sugar.
Sure.
If you could comment on how we could do that.
Yeah, I think that there are a couple of things. First of all, a supermarket is a very confusing place. We would carry maybe 45,000 stock-keeping units. And the average family only purchases 250 to 300 of those in the course of a year. And that would include 2 sizes of ketchup, and that would include Tide, and all of those things. So we're creatures of habit. So what we're trying to do with Food Flex is to provide that nutritional content so they make different decisions. On the issue of availability of, say, produce and other good quality items, we just initiated a small store format. First store we built was 15,000 square feet. We typically build 55 and 65,000 square foot stores. So that gets into urban areas that you couldn't otherwise get into because of the cost of real estate. And so you will see us do an increasing amount of that. We're challenged as a company because we're unionized. And in Southern California, for example, where maybe 50% of the population might be Hispanic background, they would shop in Hispanic markets where they would be non-union. and they might not play by the same set of wage and hour rules that we play by. So that makes it tough for us to go into inner city locations. Although we were the first to build stores in the inner city Washington, D.C. in the last 20 years. And with the small store format, I think you'll see more sort of neighborhood opportunities, and we hope to be able to lead on that. We've only got one store. It's worked great. We need to prove it out a little bit, but then that would be a real growth vehicle for us, and it would help solve some of that problem.
Steve, I want to thank you. You've inspired us and instructed us and set a great course, and I want to congratulate you. And I know all of us appreciate what you've done coming here today, share your message. Thank you.
I appreciate the invitation. Okay, good. Good.